Hello, dear friends, and welcome to today's very special event. We are so grateful you've taken time out of your day to be here with us. This month is extra special because we have just launched a free section on our eLotus course site dedicated to our beloved Dr. Richard Tan, his balanced method acupuncture, and his most popular acupuncture prescriptions. Also included on our course site are over 300 master tongue points, over 200 auricular points, scalp points, wrist and ankle acupuncture, and abdominal acupuncture, all for free so we can learn together. To celebrate Dr. Tan's lifetime achievements, every Thursday of September at this time, we have planned a special 1-hour teaching from Dr. Tan for us to watch together. It's our way of honoring him, remembering his joy, and continuing to spread the incredible healing system he gifted us all. Thank you for being here to carry his work forward. eLotus is honored to have been Dr. Tan's chosen partner in carrying forward his legacy, sharing his transformative seminars through video, and preserving his invaluable teachings for practitioners around the world. We would also like to acknowledge Evergreen Herbs, today's sponsor of this free webinar, and Dr. Tan's exclusive herb supplier for his clinic from 2003 until his passing. In addition to Dr. Tan's free videos this month, we also invite you to explore our clinical manual of Oriental medicine. Inside, you'll find nearly 100 of Dr. Tan's balanced method acupuncture protocols for the most common disorders you encounter in clinical practice. Alongside Dr. Tan's points, the manual also includes master tongue points, Dr. Li Chun Huang's auricular prescriptions, and Dr. Jimmy Chang's proven herbal formulas, all in one place to help you choose the best protocols for treating both your everyday and most challenging patients. I will include details in the chat room shortly. And now, without further ado, let's begin. Hi again, everyone. Before we begin, we had a lot of questions on how to access Dr. Tan's treatment protocol section. So I'm going to give a quick demonstration so you can easily navigate through our site and find his most valued $1 million protocols, which, yes, you might have guessed, made him millions of dollars. I imagine you can too. Let me show you how to access Dr. Tan's 40 years of experience on our website. As you can see, I'm on our eLotus homepage, and at the top of the page next to where it says Continuing Education, I'm going to click on Core. Core is the free section of our website where we list a collection of real essentials for your practice. No theoretical stuff. Everything listed is 100% practical and effective information that delivers real results. Now that I'm in the course site, to navigate to Dr. Tan's section, I'm going to click on Explore More. And then I'm going to click on Overview. This page is then organized into 3 sections. There are details about the balance method, his top prescriptions, his biography, his courses, and our Gold Pass. To learn more about each section, click on the white or purple buttons and it will take you to a new page. Now let's go back up to the first section of this page and click Discover More. Here we have a summary explaining the balance method as well as each section of the page outlined for you at the top. Here you can see the overview, step 1, step 2, visuals of the 5 systems, a chart of the 5 systems, and also a feature which shows the integrated master tongue points with the balanced method meridians. And then step 3, which provides you the mirroring and reverse mirroring charts, 4 imaging charts, as well as a chart of the hologram theory, all laid out so you can quickly reference it wherever you are. At the end of the page, you'll also see that we included a case study for a patient with lateral knee pain. If you scroll down a little further, you can also enter the $1 million combos page here. And of course, beneath that, you can see that any course purchased or accessed through our webinar weekdays provides access to our clinical manual with the top 100 protocols for the top 100 of the most common disorders you see in the clinic, all created by Dr. Tan himself. The login information can be found on the blue course access pages of your active courses. Now, let's check out Dr. Tan's $1 Million Combos and other special protocols by clicking on Explore Balance Method Prescriptions. If you're not logged in, a blue message will pop up. Simply click Log In and enter your account information. You will then be directed back to the home page, but you can quickly access this page again by clicking Core, Explore More, and Treatment Protocols. On this page, you will see a huge list of Dr. Tan's most famous protocols, including his $1 Million Combo protocols, which literally made him $1 million. For Dr. Tan's $1 Million Combo for back pain, you can see which points to needle on the left side, right side, as well as the indications, actions, and needling techniques to help you get immediate, jaw-dropping immediate results. You can also use the filters on the left if you're looking for something more specific. Let's take a look at the emotional, psychological, and mental filter. Here we can see 5 protocols for different circumstances. Let's view the 8 magical points for Shen disturbance. Here you can also see which points to needle on the left side, right side, the indications, actions, and the needling techniques as well. Feel free to explore this section and master these protocols. If you want to learn more about Dr. Tan and all of his courses, you can click on either of the last 2 sections on our Balance Method Overview page to view them. I will click on the last one, Explore Dr. Tan's Courses. Here you can view Dr. Tan's 15 exclusive courses with eLotus. You can also click into each class to learn more. If you want to access all of his teachings and unlimited CEUs for a whole year, our Gold Pass is the ultimate TCM membership to unlock generations of wisdom and knowledge. I will put the link to our Gold Pass shortly. I hope this helps you navigate our new Balance Method course section, and I will send a link to this page again for you. Now let's get started with today's webinar.
So that's a very good example we talk about, okay? When patient come in, say, I have a carpal tunnel syndrome, what you do? Exactly, 1, 2, 3. A patient come in, say, I have a tendonitis, what you do? Exactly. Patient come in, say, I have arthritis in my wrist, what you do? Exactly. Patient come in, say, I just hurt my wrist by punched my husband yesterday. What you do? Same thing, 1, 2, 3. There's no different to an acupuncture to treat bursitis, arthritis, tendonitis, carpal tunnel syndrome, as long as the pain in the wrist and in the palm. What is step 1? Diagnose. Okay, so how many meridian go through the wrist? Exactly, 6. I like you make it happen. Okay, that's why I keep on leading you to practice. Because I have a frustration through those years when I teach. Every class I teach, I tell you, okay, there's only 35% survival rate. That's why I'm changing my teaching way now. I'm more assertive, I'm more aggressive, I yell, I scream, because people are stubborn, after class, they still go back to spleen qi deficiency, okay, for the carpal tunnel syndrome. They couldn't change their habit. Or they are too chicken to try anything new. All right? That's why I want to keep on thinking 1, 2, 3, 1, 2, 3, 1, 2, 3. Make it a habit before you finish today's class. 6th meridian goes through the wrist. Look at this one. Okay, where's the pain? Right at this P7 or pericardium 7, also radiating pain like that. Which meridian is sick in this case? Pericardium and heart. 2 meridians sick, right? No matter it's arthritis or tendonitis, as long as the patient says, this is my pain. In your textbook, say what? Treating carpal tunnel syndrome, P6. That's baloney, okay? It won't work. I guarantee you it won't work. That's why you are so frustrated after $50,000 being paid. Okay? Because you stick the needle in, nothing happens. Some people even got it worse. Right? Carpal tunnel syndrome, the inflammation of the nerves is already 7 times bigger in there. How can you still penetrate the pericardium meridian and make that nerve more irritated? It's a crying baby. Come on, stop beating it. Okay? So how do you do that balance method? System 1, who balance pericardium? Answer me, please. I want you to make it habit, okay? Who balance pericardium? Liver. System 2, who balance pericardium? Stomach, beautiful. System 3, who balance pericardium? Sanjiao. You can roll your eyes, think about it. I don't mind, okay? System 4, who balance pericardium? Again, same as system 2, stomach, right? System 5, who balance pericardium? Kidney. There are 4 choices. You can do what? Liver, kidney. You can do Sanjiao. Okay, the one I didn't say, okay? Which is system 3, right? Sanjiao balance pericardium, right? Now, where are the points now? Ankle for wrist or wrist for wrist. So what are the points? Liver 4, Sanjiao 4, those are opposite side. Stomach 41, same side or opposite side. Okay, if you get lost, you're not following, raise your hand. Okay, I will be waiting for you, slow down. Okay, and kidney 3. Okay. Your choice, which one work? Experiment on the patient. Let the patient tell you which one works the best. If you insert a needle, it got a satisfied result. Fine, that's a treatment. If it's an insert a needle, you only get a very minimal relief or not even respond. Then you say, well, let's change system. Then you figure out for this particular patient, which one is the best. Okay? Yes. System 1, 3, 5 always do opposite side. System 2 and 4 can be either side. That's how I designed the numbers, okay? Carpal tunnel syndrome. How about balance the heart meridian? You see from the previous picture, the heart is hurting from the forearm through the wrist into the palm. Let's go back to the pericardium still, okay? What if the pain in the palm too? How you treat it? No big deal. It's including what? Those meridian point in the foot. Foot mirror the palm. You see that? So we were going to include in liver 3, right? We're going to include stomach of 43 or 42, right? That's in the fourth palm, right? We're going to do Sanjiao 3. Are you following? Good. We are going to do what? Kidney 2. That's in the foot. Or kidney 1 for the palm to balance pericardium. Now let's include the other line on the picture, which is a heart meridian have a problem too. System 1, who balance heart? You got to translate it into Chinese name, right? Who balance heart? Kidney, Shaoyin, right? System 1. System 2, who balance who balance heart? Shaoyin balanced by what? Shaoyang. Okay, so gallbladder balance heart. System 3, who balance heart? Small intestine, yin-yang, beauty relationship. System 4, who is opposite side of heart? Gallbladder again. System 5, who is at neighbor of heart? Spleen. So how many choices you have? 4 again. Now we have a 2 meridian involved here, right? I want you to become smarter now. Which meridian is single meridian I can use to balance both? You list on your note already, right? Who can balance pericardium? Who can balance heart? Now, who can balance both? Can you see it? Kidney, beautiful. That's a smarter choice. Forget about the other crabs. If I just use kidney, I can do both. You see that? So in order to cover those, what should I do? Kidney 1, kidney 2, kidney 3, kidney 6. That's a wrist also. You see that? Or you want 4 or 5, go ahead. That's how you choose it smarter way. 1 stone, 2 birds. Okay? I choose kidney, I balance both meridian. Isn't that beautiful? It's pretty clever, huh? So that's how you do it. But I tell you, in reality, carpal tunnel syndrome, when people come in and say, I have a carpal tunnel syndrome, there's so many different ways. It can radiate to the lung, can radiate to the pericardium, can radiate to the heart. There's so many different ways. You got to diagnose and what the combination. Sometimes a combination of a heart and lung. Sometimes a pericardium and lung. You see that? Now I'll give you a very fast quiz now. What if the patient's and my pain is radiate to the thumb, to the base of the thumb and the center of the palm? Which meridian can balance both? You can cheat. Look at your notes. Who can balance lung and the pericardium at the same time? Liver. Liver balance lung by what relationship? Chinese clock, neighbor. Okay? They're neighbor. Liver balance pericardium by what? J-in balance J-in. Beautiful. So you can use what? Liver 2, liver 3, liver 4. If the pain is going to the lung and going to the pericardium. Cool? All right, cool. Hey, do I look like a Fonzie? All right. Okay, next one. chin. The elbow is your eye line. You can reverse this too. So it's a lower limb. From the heel to the top of the hip joint is from top of the head 220 all the way down to the bottom of the chin. Your eye line is just in between. You see that? Same thing. I covered the whole head. Who can beat this deal? That's why it works. After I do the hypothesis, what did I do? Fortunately, I have a busy practice. I experiment on thousands and thousands and thousands of patients. After that, I see it work and I publish it. That's what I did in the perfect birth. Lay out a chart and come up with the most constitutional strategy to treat your whole problems. That's my next step. Doing it. I'm experimenting on people. That's why on my clinic chart now, there's one question, your birth date and time, if available. Okay? Now that's fun. Okay? You keep on thinking, create, experiment on patient. Fortunately, I have busy enough practice, experiment on patient. And to prove my hypothesis is correct. When the hypothesis being proved is precise, hypothesis turning into what? Theory. That's what it is. Okay? After 1 million times of insertion in my life, then more or less I come up with some invention. The 12 magical point is my invention. The one of the most powerful way to treat headache. Don't even worry about the diagnosis. Okay? All right? And I did use the herbs too for the acute headache pills. Okay? It works good. Okay?
Anyone can take this course and be skeptical of it, because I frankly was skeptical of what I learned in school. It was all rote memory. There's no, I mean, there was some logic behind it, but not really. You're like, oh, okay, it's all memorization of why I do this. You don't know when to expect results. And then with this, when I learned it, you said, go into your clinic Monday morning and try and see. And I already had the confidence, like, okay, my whole practice is going to turn around after this weekend. And I went in and it was just boom, magic. I just had so much confidence. Like, people could come in with the most messed up conditions, and within 10 minutes, I could have a treatment strategy. And I knew that day they walked out, maybe they're at level 10 pain, but they were going to at least leave at a level 5. And I could continue with that.
That's usually the case, yes.
So thank you.
You can hardly believe why we only have a 35% success rate, survival rate. I couldn't believe it myself either.
If I had stayed with TCM, maybe I would have survived, but I would have hated my job. I mean, for me, it was so boring. With yours, it's like, now there's 20 different options for every condition and they all work.
Right.
So, I mean,
You have so many tools, right? You have the same.
I have people that look at me, when I put in points, they look at me and like, what did you do with that?
Mhm.
It's gone, my pain's gone. And they give me really strange looks sometimes, like, I can't believe it worked. And I have more confidence because I feel like, yes, it's gonna work. You know, and I look at them and say, that's what acupuncture is, it works.
yeah, you already know.
I did it. I did a lot of survey, to people.
I give my clients Dr. Tan 101. They understand why I do what I do, and then I give them acupressure and they do it and it works. So I get them involved and it's so powerful.
Yeah, thank you. And again, I sometimes I couldn't just believe why so many people after the class, they don't even dare to try it. I don't understand, that's why I say 35% is a very surprising number for me. Okay? How come, hello, where do you are, those people, 65% in the class, When they go back, then I start doing survey. I ask around, why you don't continue practicing? Oh, I don't know. That's the first standard answer, okay? That's why they still have this doubt, anything new, anything different than 4 years and $50,000 stuff. And they just say, why? You know, that's why people think that way, you know? The other thing is, I tell you, a lot of people have the fear. Fear. Fear of what? Will they work or not? If it doesn't work, you go back to your old style. What's the problem? You know? Why nobody want to even try it? You know, that always amazed me, you know.
Well, I think when many people start out, they don't have large practices, so they feel an insecurity. Oh, am I gonna lose a few people I have by trying this style that might not work? But I mean, I would tell people to reconsider that for sure.
Yeah, I just say there's no necessary of a fear because, you know, if you are not having big practice, you spend a whole hour with the patient, you can try all different strategies. You know, what do you lose? You have nothing to lose, right? You're spending the whole hour instead of just holding the hand, you know, with the patient. Why don't you try all the different ways, you know? But please don't mix all the strategy, okay? When you try what's so-called, you know, school style, it didn't work, take the needle out, start over again, okay? Yeah. If it's balanced, it's balanced, okay? Don't mix everything together. You're going to confuse the body, okay? Yeah?
I was just wondering why this very elegant and very well, symmetrical yin yang balancing, moving from Jingwell to the sea is particularly for headaches. What is there a logic there, or is there other conditions that will respond well to this?
Because if you are really from my basic balance, start with a curriculum, you will understand more. We are doing balance. How the body get healed and cured fast if they are maintained in the format and terms of balance. And we define carefully what balance means in Chinese medicine. But this curriculum, we are just trying to just teach everybody how to treat first, okay? And someday you can come to my basic balance method, okay? And actually, every March, I have my own expo curriculum in San Diego, 4 days in a row. Okay, it's like a summer camp or a spring camp. But when you go through the 4 days, you learn a lot of different things, including Qigong. Okay? Yeah. Yeah.
So are you saying that if I were to choose this for a headache, for example, I would put in these points, it would not be okay to add other points while these points are in?
Yes, it will be okay if you even modify, you use large intestine 3 instead of 4, kidney 7 instead of 3. You can use those points in that region, in that area. Okay? You don't have to say, I have to use that point. No.
Okay.
For example, here, heart 9, you can substitute by heart 8. Pericardium 9, you can do 8 also.
Let me ask a slightly different question. If I'm treating somebody with upper trapezius pain
Right.
and I choose,
This is more just for headache.
okay, but I think what I want to ask is if I'm trying.
Okay, if you have a trapezius pain, for example, if your diagnosis is exactly, it's at the trapezius muscle pain at the gallbladder 21, for example. Okay, you can use what point, you know? Heart 4. Because heart balance gallbladder. Heart 4 by image is balancing gallbladder 21, little bit lower than the neck. Make sense? So if the trapezius muscle is on the left side, then what you do?
Well, what I want to ask you is if I were to do, say, heart 3, I believe you said, could I also do local points in the trapezius?
No,
That would ruin the treatment?
You
That's
don't
what I'm
need
trying
to.
ask.
Yeah, it may not ruin, but may ruin. But you don't need to. When you don't put any single point in gallbladder 21, what the benefit you're getting?
If I don't put a point in.
Right, right.
I guess my concern is I have patients that really like those points, and if I were to leave them out.
See?
They might feel the lack.
That's why I say 65%. I'm not a joke. I'm not saying you are bad. Okay. I just said, I know it's so hard for people to change the way they think. You, assuming your patient will like it. What is the benefit if you don't put any single needle in gallbladder 21? Have you ever thought about it? What is the benefit?
If I do not,
Yes, if you do not, what is the benefit?
that's what I'm
Think about it. Can you take advantage of the situation if I don't put any gallbladder 21 needle? Think about it. What is your benefit? Can you put a hot pack on it? Can you put a cold pack on it? Can you do trainer on it? Can you put an ornament on it? Can you ask the patient move it and test whether they are better? How much benefit you're getting? You don't need to wait until you take the stupid needle out and ask the patient, are you better? It's beautiful. That's the beauty of this method. Don't psychologically hang on there and think about the old way is the only way. No. Please. No. Open yourself. Okay? That's a benefit for you for today's class. It's not only for acupuncture, for your life track. Open. Many things we learned in the past, we need to unlearn. Believe me, so much things we've been trained, we've been taught, we've been told since our childhood. It's not true. Who said when you cook spaghetti, you put oil in, they are better. Don't need to be sticky. That's not true either. But your grandma told your father, your mother told you. Okay? They prove it, it's not true. Okay?
Underestimate the power of the human mind. Maybe 1 out of 100 patients said if I don't put a local needle in, they don't get better.
Right.
It's only about 1 out of 100, but you can't underestimate the power of the human mind.
You need to totally try to drop, unlearn. Then you see whether this is better. Okay? You're not the first one. I'm not laughing at you or criticizing. I'm not a judgmental person. I just raise my voice and tell you, pay attention. You don't have to be like that way. Okay? Yeah.
Recording stopped. Recording in progress.
So far. I have a question for you. What inspired you to become an acupuncturist? Was it the desire to heal yourself? To help those around you? Maybe because you believe in the power of holistic medicine when Western medicine fell short? At the heart of it, we all share the same dream: to be healers, to have thriving clinics, and to have the knowledge and confidence to treat any patient who walks through our doors. And that's the key word, confidence. We don't want to just put pins in and pray for the best. That's what Dr. Tan called prayer acupuncture. We want to practice with certainty, knowing that our treatments will work. If this resonates with you, then I'd love to take a minute to share about our amazing eLotus membership that has helped thousands of practitioners over the last 20 years reach acupuncture mastery and create the practice of their dreams. As much as we wish we could fit all of Dr. Tan's teachings into our weekday webinars, he left us with such an incredible amount of wisdom that it's impossible to cover it all in just these 4 weeks. Over the years, Dr. Tan has taught 15 full-length classes with eLotus. That's 97 hours of video teachings and CEUs, covering the balance method, master tongue acupuncture, sports injury treatments, herbs, and so many live demos. In honor of celebrating Dr. Tan's balance method acupuncture, you can become a Gold Pass member for an exclusive price available only today. This is truly your chance to take full advantage of this promotion and invest in yourself, to access tried and true clinical insights from top practitioners to help you create the practice of your dreams. Imagine practicing with the mastery and confidence of Dr. Tan himself. Who needs prayer acupuncture now? And it gets even better. Along with full access to all of Dr. Tan's classes, over 3,000 hours of our eLotus library, and unlimited CEUs, there are also amazing perks waiting for you. Our sponsors, Helio Medical Supplies, is giving you 10% off all acupuncture needles. Our second sponsor, Evergreen Herbs, is giving you an herbal voucher for their most popular and exclusive collection formulas line. Yes, the exact value of the Gold Pass. Pretty amazing, right? So many practitioners have already transformed their clinics with his teachings, and you can too. Remember, we entered this profession for a number of different reasons: to heal, to grow, and to become master acupuncturists. The Gold Pass will give you the tools to get there. And for those of you who are already Gold Pass members, we'd love for you to share in the chat how it has supported you in building the practice you've always envisioned. If you have any questions about the Gold Pass, please feel free to ask me in the chat room. I will include a link for more information for you. Thank you for letting me share this special news with you. This is such a special opportunity that I couldn't keep to myself. Now, let's jump back in and continue learning from the legendary Dr. Tan.
Tinnitus, severe tinnitus. Had it for about 2.5 years, and it seems to be getting worse. It's loud, it's very high pitched, kind of a hissing noise. I think it's in both of my ears because the sensation and the noise just kind of like in your brain right down the middle.
Okay, both sides equal.
Maybe a little bit more on the left, but excuse me, maybe more on the left. When it subsides a little bit, then it'll move to the left. But when it's at its worst, it's both sides equal.
Okay, and you said, last time I treated you was what, how long ago?
2 years ago
2 years
in
ago.
Hood River. Yes,
How long it last for? The result?
for just a while.
Okay, how while? 1 hour, 1 day, week, month?
It was just a short period of time. Yeah, just a brief relief, but more than I've been able to
Okay,
get since.
I have to admit one important thing to know. The method I use, the balance method, only weakness I usually don't treat that well successful is hearing. Okay? Fine. So that usually is like that. The success rate is not high in my clinic. Well, if I can get a 50% success rate, it's already good, right? Tell me the truth. But any other thing, I'm in my clinic, success rate, I would say 80-90%, no problem, okay? For the earring tinnitus, usually it's a little hard and challenge for me. The other thing is that you might not notice will be, he will feel the improvement in 6 seconds. Okay, you might not feel that. I just have to let you know. Okay, now you can put your microphone away. Then, which meridian? 1, 2, 3. When people have tinnitus, which meridian? Gallbladder, Sanjiao, small intestine. Anything else? Large intestine, whole area, right? So many times it's very involved into the gallbladder and small intestine, okay? And sometimes Sanjiao. Who can balance gallbladder and small intestine at the same time?
Heart.
Which meridian?
Heart.
Heart. That's what she said. Okay, anything else? Any other guess? Liver, not liver, okay? Just like you don't say liver maybe, okay? Liver baby, okay? Okay, so let's treat the heart and liver, right? Now we're gonna do yin yang, yeah. So we treat the gallbladder, balance liver, and heart in here also, okay? So let's do gallbladder here. Hmm? No. Okay, now, by image, okay, by image, right, the whole leg is the head. Ear is what? Look at his ear. Ear always here, right? The same line and eye line. Everybody's ear hole are different lines. They can be above or lower. For him, it's quite high in general, a little bit lower than the eye line, only a little bit lower, right? Look at his ear. His ear is very much above the eyebrow. This guy likes to study and think and pursue knowledge, know how. That his character, personality. Agree?
Yes.
How many degrees you have?
1.
He can have the potential to pursue 5 degrees.
Great.
Because he like knowledge stuff, right? That's what I'm saying here. What is this? Face reading. Okay, you can do facial diagnosis, face reading. I look at it. This is one thing. Okay, if the ear is high, this person is like knowledge, and you too. Okay, don't look back. Okay, you lay down. Okay, right? But does not mean anybody have a low ear, they're dumb in knowledge. Okay, again, horses, 4 legs does not mean you have no horses, no 4 legs. Okay, that's not true. How you look at face reading. When we say anybody's a high ear, but pursue knowledge does not mean low ear, no knowledge. Okay? All right, let's do it now. When we do liver, I'm going to show you how to do my liver points. Okay? Look at it here. Palpate, tender,
Yes.
tender,
No.
tender here,
A little.
here.
Yes.
Yes, okay, that's my liver point. You put needles in. This needle is stuck in, made in China. Okay, all right. All right, let's do another needle in, okay? So you treat the whole area, in the ear,
A little right there, yeah.
carry to the little point. Okay, now we do goblet. This is my goblet bone. Look at the tibia bone here. Okay, when I rub it, you feel some sensation go down to the leg. Good, that's a good point. To penetrate that point into the tendon, okay? All right, let's do one more point and go through the back, yeah. Into the tendon, okay? Yeah. Now let's do what, hard? Yeah. It's quite tight, no? You have scissors, right?
I get a little.
Will you? Don't stand up, okay, you need it.
Alright.
Good.
Thank you.
All right, we do hard, meridian, right, okay, you can need some alcohol. Alcohol. Okay, here. Hard three also, okay? Enter here. Also, see? Now we're going to do a point to balance what? Sun gel or small intestine, okay? Do small intestine with your alcohol. Small intestine 8, balance with the liver and the heart. Okay? That's it. Oh.
Dr. Powell, why did you do gallbladder over here? What would you balance it with gallbladder?
Gallbladder can treat the gallbladder itself, but also gallbladder is the point it can treat the sun job. Okay? Your turn. Yes, okay.
I crashed on my bicycle.
You crash on the bike.
Yeah,
Okay,
and I hurt my left shoulder very badly,
okay.
and it got frozen.
Where?
Left shoulder.
Okay,
That happened in April, and slowly it's been healing on its own. But 2 months ago, just out of the blue, my right shoulder really started hurting and got frozen. So it's like a mirror, but I've always never had any problems with my shoulder.
right now you have more being the right or left
A
shoulder.
lot more pain on my right shoulder. The front, the side, it goes down the back of my arm. Even into my wrist.
Okay, into
And
the
it's,
palm,
yes,
where in the palm?
not in the palm, along the SI channel.
Okay,
And
and
it's
here SI also?
SI also,
Here SI also or no?
not so much
Okay, but here,
here, yes,
okay,
and side.
and here,
And
but
large
it doesn't
intestine.
go this way, go what?
Large intestine
Large intestine, small intestine,
and
lung.
lung, yes. And definitely, worse at night, very painful.
Right. Which meridian can balance large intestine, small intestine, and the lung? Good. Since you made a good answer, take a pause again. Okay. All right, take your shoes and socks off. Don't push your needle, take the other pause. You didn't answer, that's why you missed it. liver can treat us three. It's okay, next time I come back in town, we'll be able to do that, I bet, okay? All right. And we treat the shoulder. Usually in image, we should treat the what? To the hip, right? But I don't want bothering to take the paint off, okay? Look at her, you know, she keep on nodding her head, right? So we want to do reverse image, okay? Reverse image between the ankle for the shoulder, right? Ankle for the shoulders. Let's see liver channel on the ankle. And which side is stiff? Sensitive here, tender,
There,
right here,
yeah, tender. Yeah,
much here, okay? Let's try to this side.
I forgot to shave my legs.
It's okay, I forgot it too, okay? I forgot it either, okay? Tender here,
Yeah,
tender here,
yes.
yeah? Which side more?
Both tender.
More tender?
Yeah, I think maybe left side.
Left side more?
They're both really tender.
Okay, let's see the left side. Okay? Do the, okay? Can you repeat the pain by raising your arm or whatever? That hurt. And
Yeah,
how far you can go with
That's-
no pain?
that's as far as I can go.
And further no pain. What do you mean by no pain? You're making face. Once you go to the point you start having pain, you stop.
Okay. There,
Right there. Okay. To the liver. Okay, tender very much here. Very much here. Okay. To the liver very much. Tender here. Very
yes,
much. Okay. Tender here.
yes,
Okay, what do you mean by yeah? Okay.
tender.
Okay, here, not much.
No, not so bad.
Tender here, here,
Yeah,
yeah.
tender.
Okay, my liver point hurt, huh? Tender here, this is my liver point, you see? Tender here,
Yes,
okay. Now try your arm now. Raise the shoulder, raise the arm. Little bit more, one more time, good. One more time. Very good. Pain decreasing,
well, it's, takes longer for it to hurt.
okay? The range of motion improves, don't you know that? Yeah. Go ahead. Okay, I should have a ruler measure for you. Okay, now where does it hurt now?
It hurts still through here.
Yeah, where the pain most?
The pain is mostly through here.
I want you to use one line, okay?
Lung meridian.
Lung meridian.
Yes.
Say more, lung meridian,
Yes.
right?
Mhm.
Okay, and the liver enhance the lung, okay? You can balance the lung itself. Urinary bladder can balance the lung. Who else can balance the lung? Spleen. Okay? Who else can balance the lung? Liver again. Anything else? Large intestine, right? Large intestine can balance the lung. Okay, just try large intestine this time. What?
Like you be better.
You like you be better? I don't, okay? Into large intestine, right? Okay, you watch it. You like you be better.
Since you're nearly done.
Tonight, when you go back to your hotel room, rent a tape to watch it. Okay, the tape, the title of the tape should be Who is the Boss?
Just watching, not bother.
All right, let's try large intestine. Okay, with reverse image. Actually, I would like to do here for here, okay? But let's try reverse, see how it goes, okay? Tender, let me know. Tender here,
Yes,
here, no?
not so much.
Here?
Yes.
Yes, okay, tender here. The large intestine 5 for the joint of the shoulders. Tender here. How much? Tender here.
A little more.
Okay, and here this way?
Yes.
Yes, large intestine more. When I go through the thumb, it does not feel that much. We put it in what, in cool, large intestine 4.5. Towards the large intestine shapes, okay? How about here? Much here? Much. When this come down here, does it come to the elbow?
Yes.
It does come to the elbow, that's to a large intestine 11. Okay, large intestine 11, okay? All right.
Move my shoulder.
Yeah. Okay. Okay,
It feels looser.
loser,
Yeah.
okay, the stiff, the pain should be reduced. The stiffness usually need a little time to cool, okay, see, it's including the range of motion again. Okay, when you're here, do a few times, okay? Yeah. Are you an acupuncturist?
Yes.
Yeah, then throw your own needles. I'm not going to do that.
Ali.
Okay, do you want?
I like to treat you if you have a pain, so we can show people how easy.
I
can be done.
Four pains.
Oh, you already, oh,
Should I choose an old one?
give me the worst one.
Okay,
Right now, you feel the worst one.
okay, well, I'd say left shoulder pain is the worst, but I also have ankle pain if that's more interesting.
Right ankle pain, left shoulder pain, okay. If we skip step number 1. I just want us to raise simple straight question. Which area we can treat the shoulder and ankle at the same time? By image or mirror.
Oh.
Where we stick the needle if we find the correct balancing meridian, which can treat the shoulder and the ankle at the same time. Challenging, no? Two choices. We can choose wrist or we can choose ankle.
Yeah.
But all opposite side, not opposite, all different than the original problems. You can use the left ankle to the right shoulder and the right ankle problem. Can we? Or we can treat the left wrist for right wrist for the ankle and the shoulders. But I like to use ankles first. Okay? Now, where is the pain in ankle?
It's right here.
In between gallbladder and stomach. Okay, where is the pain in the shoulder?
It's.
What is this, Oregon symptom? Everybody have this, you see that?
Yeah, well, yeah, I have upper traction too.
Okay.
This is from 5 months ago.
This one here,
Yeah.
okay,
Back to here.
more on the sun jaw. And lung. Okay,
I'd say. Yeah, it's MRI.
okay, sun jaw and lung. Which meridian in the ankle can balance the opposite side ankle between stomach and the gallbladder. Also, treat the shoulder, on the sun jaw and down. Holy moly. Who can answer my question correctly? I'm gonna buy you a drink after class. Repeat the question, which meridian can balance the lung and sun jaw, and also the ankle, stomach, gallbladder. Beautiful, spleen.
Nice.
But spleen does not balance gallbladder, so we get by a little bit, okay? Now you did very well.
Have a drink.
What do you think? What do you drink?
Non-alcoholic drink. Some LaCroix.
Don't tell me Coke. Okay?
No. Scotch.
Scotch, it's my kind of drink too, after class, okay? Let's do spleen, right? I'm gonna pop it around spleen and liver. You see, liver can balance gallbladder. Then we put a few needles. Liver can balance the lung also. You see that? That's how you think, ladies and gentlemen. When I teach you to think. Acupuncture is not the knowledge what point to treat what. It's a knowledge of thinking. It's knowledge make you even smarter. It's knowledge exercise your brain. Okay? Let's do it now, right? Nice color of your tone.
Thank you.
You're welcome.
I'll do yours if you'd like.
You will do my toes, you mean?
If you'd like.
Oh, my God. You like my individuals?
I was noticing them earlier.
You think it's I sweat that way?
No, I thought it was makeup.
Oh, makeup.
Makeup.
Andrea,
That's very sore.
Andrea.
Also sore.
Okay, let's do what? Spleen 5A. Liver 4. Look at our end. Loosening. Probably 40%, right?
I don't think so.
Yeah. You don't need to squeeze your eyes now anymore. I make a face like you were suffering so much. Okay, tender ear. Are you an acupuncturist again? Treat yourself like that every day. And take a 5 days break every 15 days.
Okay.
Until it's totally done. Okay? Liver 4 artery. You see the small area, I put in 4 needles. Okay? Now, move your ankle and your shoulder. See how you feel. Go ahead.
My ankle actually feels better.
Much better.
Yeah.
How about your shoulder?
I'm feeling it.
Ah. The line changed. And many people say, oh my God, I didn't help the patient, or the pain just moved. Believe it's not moved. It was there. Okay? It's just the primary symptom is better, the secondary are more noticeable. All right? No big deal. It's changed after that. And this is on the large intestinal channel. We still can use the liver to follow up. But remember, we only put a whole bunch of needles around the ankle, but then knee, we did not treat the top shoulder. So we need image right to move those points more away, more proximal away from the ankle. Make sense? That means what? Proximal away from the neck. Because ankle, neck, the shoulder is lower. So we have to move away, proximal away from the ankle to image the shoulder area. Okay? Let's do it. Upper shoulder still there. We only take care of the joint. Okay? Let's do it. Okay, we're going to do liver channel. Let's try palpate between liver 4 and liver 5. Why liver again? Because our diagonals in step number 1, the upper shoulder pain is locating where? Large intestine. Okay, we're using liver, balance, large intestine. So tender,
So,
tender.
yes.
Okay. See, when I am doing the closer to the ankle area, she said there's no option, move up, option more significant. See that? Tender here,
Yes.
yeah. Tender here,
Yes.
all right. Better? Yeah, good. All right, you need to wait for 6 months to see the result? No, 6 seconds. All right? This is how acupuncture work. 6 seconds. That's why if you don't practice on Monday, you're a patient. I really think you're a cuckoo. Right? Right? Do I need to put any local point there? Ma'am?
No, just a massage.
All right. Next.
Whiplash here.
Oh my gosh. No,
And small intestine.
right here, numbness.
Yeah.
In this area.
Yeah.
Okay, balance lung and pericardium. Hey, Mr. Scott, you on the rock?
Liver.
Wonderful. Great. Liver, balance lung, and pericardium. And here, gallbladder, you say here. Gallbladder and large intestine area. Liver can balance those. So let's focus on liver. Liver can balance lung, liver can balance pericardium, liver can balance large intestine, liver can balance gallbladder. Hallelujah. Okay? As a liver, they can do so much. You see that? Let's treat the liver. That's why you observe me why I use liver so much in the clinic and also my liver point so powerful. Because so many use, you can use them. Okay? So let's do it. All right? You Democrat or Republican? Just joking. Okay, so the answer. All right, let's try left side or right side. Okay. Okay, let's do opposite then. Okay, so I'm a person like the opposite side of the chain. Okay, so let's do liver 3. Why liver 3? I'm sorry, John, I didn't show myself. Okay, and liver 3.5. Why we do those? Give me a reason, ladies and gentlemen. I'm treating the palm, don't forget it, okay? Yeah, because we are using the foot to treat the palm. Whenever your patient complains to a practitioner, as a good practitioner, you never forget what the problem is. Don't lose your focus. Okay, even I'm lecturing, I still remember, I need to treat your palm, okay? Now, tender here, okay, let's do what? Liver 4.2. Right? Liver 4.5. Okay? Liver 4.7. Right? Liver 5. Right? Any tenderness here? No more. That's it. Move your shoulder. Do your palm better, palms better? Good. Still in the where? In the finger. I didn't do finger yet. Let's do finger, okay? Finger on what? Liver 1, okay? And liver 1.5. That's the finger. Right? Now move your hand. Better. How long you need to wait to feel better? 6 months? Even faster than a shot of tequila, right? All right. Did I prove enough to you?
As we wrap up today's session, I want to leave you with something special. Our eLotus team has gathered Dr. Tan's invaluable teachings and made them available on Core, as well as in our clinical manual. Dr. Tan personally outlined his top treatment points for 100 of the most common problems seen in acupuncture clinics. And now, all of that knowledge has been preserved by our eLotus team and passed down to you. You can access Dr. Tan's top treatment points in the links I will share with you in just a second, along with your login information to access our clinical manual. Thank you so much for joining us today, and we hope you leave with new insights and inspiration. And if you found this webinar valuable, please share it with your colleagues. And we look forward to seeing you at our next webinar.